The next question, the member for Toronto Centre.
Thank you very much, Speaker. My question is to the Premier. After a question period this morning, the government can vote for the Gender Affirming Health Care Act. They can choose to take action. They can choose to save lives. I've never spoken to a single trans Ontarian who believes that Ontario's system for delivering gender-affirming health care is actually working. But during the debate on Thursday, members of this government gave indication that they would not be supporting the bill. Speaker, I hope members of this government all know that by voting against this bill, it means that they're voting against members in their own community. It means that they're voting against constituents. They're probably even voting against members of their own family. Trans and gender diverse constituents who are struggling to access health care in Ontario need to be treated with the same level of respect as every other Ontarian, Speaker. Speaker, yes or no? Will this government state on the public record whether or not they believe that gender-affirming health care is life-saving health care?
Members will take their seats. Minister of Health.
Speaker, there's no doubt that all Ontarians deserve and need to be able to have confidence in their healthcare system, which is why we believe that the expansion of family health teams, including specific teams that have programs as part of their LGBTQ+ services and offer specific clinics for trans populations which provide interdisciplinary primary care services. You know, Speaker, we're talking about the member opposite forming a committee. We're actually investing in communities. We're investing in those primary care teams that are providing the services on the ground. And that is critically important to our government to make sure that all individuals in Ontario, regardless of how they identify, get the health care they deserve in the province of Ontario.
And the supplementary question.
Thank you, Speaker. I'm disappointed by the minister's answer, but I am not surprised. By refusing to acknowledge that gender-affirming health care is life-saving health care, this government is sending a very clear message to trans Ontarians. They don't matter. They don't count. Their lives are not important. Advocates have been asking for years to expand OHIP coverage, to reduce the barriers to accessing gender-affirming care, and to make sure that Ontarians don't have to leave the province to get the life-saving care that they need and deserve. Exactly. Too many people in this province are clearly paying out of pocket, and they're waiting for years to access gender-affirming care. A message that they need to deliver to this government is that they need to be seen, heard, and respected when they go see a healthcare professional, and that is not happening right now, Speaker. We need to ensure that everyone in Ontario can access healthcare that's free of discrimination and have equal treatment. Speaker, my question to the Premier, to the Minister of Health, is that during the last term, they voted for gender-affirming healthcare. This is now the same bill. Why has this government reversed course? Why are they not supporting trans rights and their right to gender-affirming health care?
And to reply, Minister of Health.
The member opposite is talking about forming a committee. We are talking about real action that is making an impact in communities across Ontario. Is the member opposite suggesting that the expansions of CHCs, the expansion of community health centers, of family health teams that provide specific service for the LGBTQ+ community is not an appropriate investment? I don't want to keep talking about it. I want to act.